Hi, I'm Andrea. I'm one of the speech therapists here at Health South, and I'm going to talk to you today about dysphagia. Dysphagia is any difficulty with swallowing. It can happen at several phases of the swallow. It can happen when there's food in the patient's mouth, when they're attempting to chew their food and swallow. It can happen when they start to initiate the swallow. It can happen as food is passing through the throat, past the airway, and it can also happen at the level of the esophagus. Now, the whole goal of treating patients who may have a swallowing problem or dysphagia is to prevent what we call aspiration. Aspiration is when food or liquid actually makes it down into the lungs, and that's the last thing we want. So ultimately, we try to do whatever we can to prevent that through therapy and exercise. Now, aspiration sometimes is apparent. The patient can cough, the patient can choke when eating or drinking something, but sometimes it's actually silent and there's no physical evidence that food or liquid has gone down into the patient's lungs. Now, if this food or liquid is constantly getting down into the patient's lungs, it can result in what we call aspiration pneumonia. So that's why it's extremely important to identify these patients or who are at risk for aspiration so we can do everything we can to prevent this aspiration and strengthen their swallow muscles. Now that we've gone over a little bit about dysphagia, let's go over the quiz that you took. Alright, question number 1. It says, dysphagia is A, when you can't feed yourself because one arm is weak, B, problems with urination, C, a fungus that grows under your toenails, or D, problems with swallowing. The answer is D, problems with swallowing. Question number 2. Someone who is on nectar-thickened liquids should not have the following. A, ice cream, B, Jell-O, C, ice chips, D, thin liquids, E, all of the above. The answer is E, all of the above. Number 3. The patient in room 101 door has been placed on a mechanical soft diet with thickened liquid. A staff member gave him ice cream the other day and he did not cough. He loved it. So now it's safe for me to give him ice cream when he asks for it. The answer is false. Question number 4. Which two of the following are the most thin? A, Jell-O, B, honey thickened juice, C, nectar thick coffee, or D, ice cream? You should have answered A, Jell-O, and D, ice cream. Question number 5. A person with dysphagia should recline in bed when eating or drinking to help the food go down more easily. You should have answered false. Hi, my name is Jerry Weinman. I'm a speech pathologist here at Health South, and this segment is about different diet consistency levels and thickening liquids. So I thought I would show you a few things that we have available in the hospital here. If your patient is on a restricted diet and they're restricted to thickened liquids such as nectar thick or honey thick, you may be in luck. You may not need to thicken anything. We have pre-thickened water, coffee, milk, even the Mighty Shakes that are in the kitchen are nectar thick consistency. Tomato juice is nectar thick consistency. And if a patient needs Ensure, you can offer it to them in pudding form if needed. We have that also. So let's talk about the different levels. Honey thick is the thickest. It's like the name, as thick as honey. Nectar thick is a little bit thinner than that, and it's the consistency of the syrup in a can of peaches, the heavy syrup in peaches. Let me show you how to thicken to nectar consistency. You have an 8-ounce cup. A good rule of thumb is to take the ice out first and then add 2 heaping spoonfuls of thickener. Okay, Stir it really, really well. And let it sit for just a minute. Usually within about a minute it should thicken to the desired consistency. You may need to add just a little bit more if you have 8 ounces. You can see it kind of drips slowly off the spoon. I'm going to add just a little bit more powder, just a few little sprinkles. And that's nectar consistency. Okay. If you need honey consistency, you would just add a little bit more thickener and let it sit for a minute, stir it again until it's thick enough for the patient. Let's talk about the different food consistencies that we have at the hospital. A diet that you may see with our patients who have dysphagia is mechanical soft. And what that means is basically the food is really easy to chew. It's moist, it's soft, the meat is ground, usually with gravy on it, and it's easy for the patient to chew and swallow. Some patients require pureed consistency because they're not able to clear the food out of their mouth if it's solid. So we'll put them on pureed. That means that there should be nothing textured in their food. It's just the consistency basically of yogurt or applesauce. That pretty much concludes the review of consistencies. I just wanted to remind everybody that ice cream, Jell-O, and Ensure are considered thin liquids. Thin liquid is difficult to swallow for a lot of patients who have swallowing problems just because it rushes to the back of the throat quickly, and that's the reason why we use the thickener. If you ever have any questions about any of the diet levels, or if you're concerned about a patient, please let one of the therapists know in our department. Thanks so much. Hi, my name is Jessica Sweet. I'm an inpatient speech therapist here at Health South. I'm going to be talking with you today about how we communicate diet changes and swallow strategies with nursing and with other staff in the hospital. First, any diet changes or specific swallowing strategies will be written in the physician's orders section of the chart. Next, we will post signs in the patient's room indicating any special diet consistencies that the patients are on, or any special strategies that we want them to use. And the first sign that everyone who is on an altered diet will get is this one. It will say the patient's name and room number, the diet consistency that they are on, any special strategies that we want them to use, and also how their medications should be given. And this is typically on their closet door in the room. Then typically behind them, behind their bed on the wall, we will post any other specific orders like giving medications whole or crushed, whether or not they should be using straws, if they need one-to-one supervision from the staff, and so on. So we do post signs in the room to communicate with nursing and therapy. Also, if you are going to give the patient medications and they're in the gym, not in their room, we have signs posted on their wheelchair as well. So if they're on thickened liquids, if they should not use a straw, and also how their medication should be given. All of that will be indicated on the back of their wheelchair. Also, if they're NPO, nothing by mouth, then we will hang a sign on the back of their wheelchair that is purple. Finally, we notify the kitchen of diet changes daily, so they get a written notification of any diet changes we make in the chart each day. If your patient is in need of dysphagia treatment, then they will usually be or often be in our dysphagia group at 11:15. So when you see the letters DYS on the schedule, the treatment schedule, that just stands for dysphagia group. If you notice a patient is displaying dysphagia symptoms, please tell that patient's physician. We cannot do a dysphagia eval without first having an order from a physician.